Assalamu alaikum. The previous video was stopped abruptly, so let us continue from there. We were discussing about the standard 12 lead ECG, and I told you that in standard 12 lead ECG, we are having a view of the heart from 12 sides. Here, 12 lead ECG means that 12 leads are obtained by using this ECG. Like there are 3 limb leads, 3 augmented leads, and 6 chest leads. And remember, it doesn't mean 12 lead ECG doesn't mean that we place 12 electrodes onto the patient's body. No, it is wrong. 12 lead ECG doesn't mean it. Actually, 10 electrodes are placed onto the patient's body. I will discuss it later in detail. 6 electrodes are placed onto the chest of the person, and remaining 4 electrodes are placed onto the limb of the patient. So I told you the difference between the what is the difference between the electrodes and leads. So you must know that difference in order to start this chapter. I am following Irfan Masood here, and inshallah I will continue following it in my remaining videos as well. So in the previous video we just had the introduction of it, so let's start the standard 12 lead ECG. These are 3 limb leads, 3 augmented leads, and 6 chest leads. And these 3 limb leads are actually bipolar leads, augmented leads are unipolar leads, and chest leads are again unipolar leads. And here this picture is showing you that by using which lead we are having which view of the heart. It will be shown clearly in the later discussion. I will show you another picture where it will be clear to you people more. Okay, so for starting with the limb leads, you must remember that lead 1 is between right arm and left arm, lead 2 is between right arm and left leg, lead 3 is between left arm and left leg. It will be very easy for you people to memorize these leads if you suppose these leads onto your own body parts, like from right to left, right arm to left leg, and left arm to left leg. Okay, now you must know that which type of electrode is placed on which limb. Like in the case of lead 1, negative electrode is placed on right arm, positive electrode is placed on left arm. And in the case of lead 2, negative electrode is placed on right arm, positive electrode is placed on left arm. And similarly, in the case of lead 3, negative electrode is placed on left arm and positive electrode is placed on left leg. Just remember the direction of the leads, like lead 1 is going like this, lead 2 is going like this, and lead 3 is going like this. And after that what you have to do, just do negative positive, negative positive, negative positive, right? Before starting the augmented leads, I will tell you about the color of the electrodes that are placed onto the patient's limbs. Like if you consider that this is the right side of this person and this is the left side, then just remember that red colored electrode is placed here, yellow color is placed here, green colored electrode is placed here, and black color is placed here on right foot. But this black color electrode is considered as a neutral electrode. It is not conducting any type of electricity. It is considered as a neutral one, or we can also say that it is only used for earthing. So the whole game is between these 3 electrodes. And in the case of upper limb electrodes, you place the electrodes onto the wrist of the patient or on the styloid process of the ulnar bone. And in the case of lower limb electrodes, these are placed onto the foot of the person proximal to the ankle, like somewhat here, like somewhat here. I hope so this will be making sense now. Now just have a look at this picture. You can see from here again, this is lead 1, this is lead 2, and this is lead 3. And you also know the type of the electrodes, that where negative electrode is placed and where positive electrode is displaced. Just for your mnemonic and just for your memory, remember that where there is positive electrode, we are viewing from that side, like from here we are having a lateral view of the heart in this case. And in the case of lead 2, we are seeing the heart from the inferior side, and again we are seeing the heart from the inferior side. I hope so this will be clear. And it is not just for fun that you are taking the view of the heart from the inferior side, from the lateral side. It is mainly used for detecting any type of abnormality in the heart. Like if there is any abnormality in the lead 2 and lead 3 of the ECG, then it shows that there is any issue with the inferior wall of the heart. Like there can be any ischemia of the inferior wall of the heart, or there can be any other pathology in the inferior wall of the heart. And similar is with the lead 1. If there is any abnormality in the lead 1, it shows that there is any abnormality in the lateral wall of the heart. So next one is the augmented limb leads. In augmented limb leads, again there are three leads: AVR, AVL, and AVF. Here A means augmented, V means unipolar, R means right, L means left, and F means foot. Okay, right arm, here is right arm, L means left arm, and F means obviously left foot, as there is nothing to do with the right foot. So it is also called unipolar leads, because here we consider a heart central point as a reference. We just consider, like if this is a person's heart, we consider a central point in the heart, and we then record the signals between the central point. And if this is right arm and this is the left arm of the person, and in the case of AVR, we record the signals between this central terminal, which we consider as a negative electrode, and the right arm where positive electrode is placed, right? And in the case of AVL, we record the signals between the central point, which is taken as negative, and left arm, which is taken as positive electrode, where positive electrode is placed. And in the case of AVF, again, we record the signals between the central point of the heart and the left foot. So I told you before that for memorizing, for your own memory, just remember that where there is positive electrode, we are viewing from that side, like here shown, like here shown, like here you can again see it. Okay, now let's discuss about the precordial leads or chest leads. Just remember that there are six chest leads, and you can remember the colors of these. I'm sorry, there are six. Yes, there are six chest leads, and six electrodes are also placed onto the chest, and you can remember the colors of these electrodes as Rida yet goes by orange plain. Just consider that if this is V1, V2, 3, 4, 5, 6, Rida yet goes by orange plain. R for red, Y for yellow, G for green, B for blue, and O for orange, and P for purple. Alright, Rida yet goes by orange plain. Now let's discuss about the location, that where these electrodes are placed. In the case of V1 and V2, both of these electrodes are placed in the fourth intercostal space. V4, V5, and V6 are placed in the fifth intercostal space, but V1 is placed in the fourth intercostal space just at the right sternal border. If this is the sternum of the person, then it is placed at the right sternal border, but V2 is placed at the left sternal border. And V4 is placed in the fifth intercostal space but in mid clavicular line. And similarly, V5 is placed in the anterior axillary line. V6 is placed in the mid axillary line, right? And V3 is placed between this V2 and V4. I hope so this will be clear. Now just see this picture from your Irfan Masood. Here you can see that lead 3, AVF, and lead 3 are telling us about what? They are actually telling about us about the inferior wall of the heart. And similarly, lead 1 and AVL and V5 and 6 are telling us about the lateral wall of the heart. V3 and V4 is near to the anterior wall of the heart. V1 and V2 is near to the interventricular septum. So if there is any abnormality in any type of the leads, they will show or they will tell us about any abnormality in the particular portion of the heart respectively. Thank you very much.